efforts of government.
Bakari Jete alias Bakso, APRC's second administrative secretary, described the move as a noble one and thanked all those behind this initiative.
The unity of the APRC Youth Wing and the core committee are very much happy to associate themselves on this noble cause.
Drivers who mainly benefit from the exercise could not hide their happiness seeing the good work done by the youth. One by one, some of them expressed their heartfelt thanks and appreciation to the youths, saying it is everybody's business to embark on such a noble cause.
Really appreciate that, and now I think the number of accidents would definitely reduce.
Samuel Bah, GRTS.
By the Gambian people on European Union's Article 8 political dialogue with the Gambia government, the general public is hereby informed that the National Assembly shall convene an extraordinary session Monday, 21st January 2013 to consider the said motion. A news release from the Office of the Clerk reveals that the August Assembly does consider and approve the petition by the Gambian people on the European Union's Article 8 political dialogue with the Gambia government. The sitting will start at 10 prompt and the general public is invited. The Minister of Health and Social Welfare, Balagaba Jahumpa, recently visited a €60,000 building construction project at Banjulunding Health Center. The new facility is expected to accommodate the health center's labor, postnatal and antenatal wards. The project is being sponsored by the charitable organization called Support and Build the Gambia from the Netherlands in collaboration with the community of Banjulunding. Babkar Senghor reports.
President Jame, Minister of Health, Be Komale, Amutefe, Ni Alasonta, Nyatodoro.
It was a joyous moment for the people of Banjulunding to share with the visiting Minister of Health and Social Welfare some of the issues confronting them in their bid to improving the condition of their health center. The officer in charge of the health center, Binki Ture, hailed the support the community receives from their friends from Holland in maintaining the condition of the health facility.
This building that the minister will be laying the foundation block will comprise of postnatal ward, labor ward, nurses station and toilets, and hopefully, if completed, will improve quality health service delivery of Banjulunding and the surroundings.
The Alcalde of Banjulunding, Mono Longs Jaju, called on his people to continue to play key roles in the development of the country through proper community-led development efforts. Another member of the community, Lamin Rongo Jaju, explains the fruitful link between the community of Banjulunding and their Dutch counterparts, who mainly help the medical center with equipment.
The founders have been sponsoring generators, a heavy-duty generator that is placed over there, just to reinforce the NABEC electricity supply in the case that electricity goes on. They have been supplying medical material. You understand? They have been supplying different things. And, you know, after the fence, we solicited from them that they should help us to build another new maternity. Because we notice the labor ward here is small.
The regional health director also commended the foundation and the community of Banjulunding for spearheading this noble initiative, urging staff of the facility to deliver to expectation and with a high degree of professionalism.
This is a very important project and most welcome development. As we all know, Banjulunding Health Center is strategically located and is covering 18 communities benefiting from the health services here in this facility. This health facility on annual basis, on average, conduct 1,500 to 2,000 deliveries in this small health facility. Now imagine now with this project that is coming in, it will expand the facility, give more capacity for the facility to do more work.
The Minister of Health, who was invited to belatedly lay a stone on this construction, expressed delight in yet another development that will help in addressing health issues such as reducing infant mortality and maternal mortality in the area.
The Ministry of Health, and of course, on behalf of His Excellency, the President of the Republic of the Gambia, we would like to take this opportunity to express our thanks and appreciation to the Dutch Foundation and all Dutch philanthropists that have contributed towards the construction of this labor ward.
A member of the Dutch team spoke of their numerous interventions in helping communities across the country through the provision of free labor in construction and providing supervisory duties. For Grts News, this is Babukar Senghor.
Your Change for a Change, an international youth group operating in the Gambia, recently celebrated 2 years of existence with a march past and symposium. Members of the group used the milestone event to distribute bed nets to a local community in the West Coast region. We have details in this report.
Your Change for a Change is an international voluntary organization established 2 years ago by young Gambians, both at home and abroad. The group's objective is to join the wagon of health promoters in providing quality and responsive disease prevention and management measures for communities. As the youth group celebrates its 2-year anniversary, a fitting theme has been chosen to mark the milestone. Adam Jan Sanka, Program Manager, Malaria Control Program under the Ministry of Health and Social Welfare, commended the youth for the role they play in advancing health-related issues.
What government needs at all levels is partnership for results. Particularly when it comes to malaria control and prevention, we need a lot of partnership. We need partners to support the efforts of government because, like we said, government cannot do it alone, and we need commitments at all levels. We need commitments at the global level, commitments at the regional level, and commitments at the country level. People and organizations have to be part of the efforts of government and complement them. That's the only way we will be able to achieve our set objectives and goals. And that is what this organization, has come to do. They are working on malaria control and prevention.
The organization's country director, Lamin Dabo, dilated on the history of the organization. Dabo called for attitudinal change in properly dealing with preventable diseases.
Symbolize the fact that we want many people to understand that most of these preventable diseases can definitely be reduced greatly if with just a little shift in our lifestyles, with just attitudinal change, we can definitely eradicate some of these preventable diseases. And today, as you can see young people were out to ensure that we inspire them with the guest speakers at the symposium so that they can understand the concept and be able to take their lead role in their communities and in their families.
Dabo also appealed for greater support to charitable organizations, something he said will help in providing needed support to the vulnerable.
You change for each change. The meaning is you have a little change, not only in monetary terms. If you have time, if you have your energy, if you have other resources, you commit it, that little change that you have, out of your time, out of your energy, out of your money, so that we can effect a bigger change in another community, so that we can effect a bigger change in somebody else's life.
Musa Jawara of the Medical Research Council spoke of the evolution of insecticide bed nets, its effectiveness and the role the Gambia played in its appeal to the public.
The Gambia has played a key role initiating the pilot studies, the field interventions, until it was well established and confirmed that insecticide-treated bed nets work. And there are two types of treating nets. One is the conventional way, and the other is factory manufactured ones.
With the World Health Organization recommending the long-lasting insecticide bed nets to be used, the conventional method is being phased out and health officials are urging for the use of the required treated bed nets. The voluntary organization is currently registered in Sweden, UK, USA and the Gambia, and they are looking forward to register in more countries the world over. For Grts News, I am Aja Amisise.
Time now to take our first break. We'll be right back.
The NAWEC Staff Association, under the Chief Guest of Honor, His Excellency the President of the Republic of the Gambia, Sheikh Professor Alhaji Dr. Yaya AJJ Jammeh, is staging its 3rd annual gala dinner and dance in association with the international superstar Assane Ndiaye of Senegal, Joliba Kuyate and Abu and Fafa. This program is in support of His Excellency's drive to turn the Gambia into a city-state by providing all basic and essential services such as electricity and water to the Gambian populace irrespective of where they live. The gala dinner is slated for the 25th of January 2013 at the Senegambia Beach Hotel. Tables are as follows: Platinum $60,000, diamond $50,000, gold $40,000, and silver $35,000. Each table comes with 10 gala dinner tickets and cash power raffle tickets. Individual tickets $1,500. January 25th, that is their dance at the Paradise Suites Hotel, Penchami Hall. The tickets are as follows: VIP $600,